Healthcare in the spotlight as officials from the Biden administration travel to central Wisconsin. News 9's Nick Robinson now in studio with more on the new funding announcement that they made here.
Health and Human Services Secretary Javier Becerra, along with other senior Biden officials, were here in central Wisconsin to talk about an issue all too familiar to Wisconsinites, accessing quality health care no matter where you live. And they brought their checkbooks in hopes of helping. Whether it's their local hospital closing, increased medication costs, or lack of resources for clinics, people in central Wisconsin have been through the ringer when it comes to health care. But it hasn't gone unnoticed, with Becerra and others coming to hear directly from them. It started with a Q&A session with healthcare providers at the Rothschild Pavilion, where they announced that the HHS department would be giving an additional $11 million in funding for rural communities to expand residency programs for healthcare providers. Becerra said it's important to keep quality healthcare workers here at home where they're needed the most.
We know that if you start your residency program as a newly minted physician in a particular location, by the time you finish that residency program in 2, 3, 4 years, chances are you're going to stay in that community.
That went along with the administration stressing the importance of access close to home.
Perhaps the most important thing post-COVID that we've learned is if you don't have access, you don't have care. And if you don't have flexibilities, even if you have care, you may not get the care you need.
The group then traveled to Mid-State Simulation Center at Aspirus Riverview Hospital to see the next generation of Wisconsin's healthcare workers getting some practice. White House Domestic Policy Director Neera Tanden said that centers like this will help provide a path to a good-paying job without the expenses that come with a college degree.
We want to ensure that people have opportunities for middle-class jobs, good-paying jobs, with multiple pathways to get there.
Administrations work to expand mental health care access with the 988 crisis prevention line.
Now, Nick, before you go, you mentioned that they were talking about some of the concerns with health care. Did they also mention what's actually being done to address that right now?
Yes. One of the biggest ones they focused on today was mental health care and making sure hospitals and clinics are equipped to address the growing need in the Badger State and beyond. Becerra told me that the funding they announced today should help address that as well.